We're going to discuss the topics that matter to you: race, single parenting, domestic violence, education, and now, The Hagir Show.
Hello and welcome to the Hagir Show. I am your host, Hagir. We are coming to you today from Hamilton Health Center, and we have Sarah and Giselle. Would you like to introduce yourself and tell us what you do here at Hamilton Health Center?
Sure. My name is Sarah DeChamplain. I am the HOPE Program Director, and the HOPE Program is our HIV care program here at Hamilton Health Center.
Hi, my name is Joselle Mator. I am the social media outreach worker here at Hamilton Health Center. So I also work with the HOPE program as well as the Opt-in for Life program.
Well, welcome. We are happy to have both of you here. Can you explain to us what HIV to begin with, or everyone out there who doesn't know?
Sure, absolutely. So HIV, it stands for Human Immunodeficiency Virus, and it is a virus that chronically infects people. It's usually spread through unprotected sex or injection drug use, things like that, and it stays with the person throughout their whole life. A lot of people, when they think about HIV, think about the AIDS crisis in the 1980s, sort of the face of what people used to think about. But today, it's a really manageable illness. A lot of our patients take one medication a day. It is really important to take medication if you're HIV positive. That helps control the virus. And it's very important to get into medical care.
Okay. How huge is it of an epidemic? I know back then it was a scary thing to hear about HIV, but what are the resources now and how manageable is it? You said just the medication.
Sure, it's very, very manageable. Nowadays, people who are HIV positive can live a normal length life, really happy and healthy life with the right treatment. Back in the 80s and the early 90s, and even in the last 10 years, medications have really changed. People used to have to take handfuls of pills. Now most of our patients take only one pill a day, which helps control the virus and also prevents them from transmitting the virus to anybody else.
Okay. Do you think it's getting worse or better? Number-wise.
Number-wise, it actually hasn't changed a lot. The rate of new infections has stayed kind of the same over the last few years. So on average, it's between 35,000 to 40,000 people are newly diagnosed with HIV every year in the United States.
30,000, you're saying?
Yeah, between 30 and 40,000. So it's still a major problem. A lot of people sort of think the HIV and AIDS epidemic is over and don't think about it as much anymore, but it's still infecting people and having a major impact on people's lives. So people can live a healthy life now. It's still a major prevention issue.
Do you do researches on finding how it is spread now? With the knowledge, with everything that we know, people are still not using.
Yes, people still, getting people to practice safer sex is always a challenge. And that's the most common way that HIV infection is spread. It's usually through unprotected sex. The second most common way is through injection drug use. And as you know, most likely, in the United States, we have a huge opiate crisis, which is really driving the number of HIV infections. I would say at Hamilton, about a third of our patients were infected with HIV through using injection drugs at one time or another. So that's another major issue that causes the spread of HIV.
Okay. And what do you guys do here in Hamilton Health Center, basically, awareness-wise and education?
Sure, absolutely. So the bulk of our work here at Hamilton around HIV is we provide HIV care. We have some amazing providers who have been treating HIV for a long time, are experts in their field, and they provide primary HIV specialty care. And what that means is while they also treat people's HIV, they're also the client's primary care doctor. They treat their whole health. Aside from medical care, we also offer case management. So case management is a type of social work service. So there's a lot of social issues that sometimes go along with HIV. It disproportionately affects people in poverty, people with mental health problems, people with drug addiction problems. So we have case managers on staff that can help make sure patients are linked with the resources they need, from housing to medical insurance to other types of assistance. On top of that, we also offer rapid HIV testing. So people can walk in anytime that Hamilton is open and get a free 20-minute HIV test. We always recommend that everybody who's sexually active gets a test tested at least once in their lifetime, and if they think they might be at risk, at least once a year. That's another service that we offer.
Okay. Do you have this information out there, or unless people search for it, they know? How do you get this information to the public?
Sure, absolutely. So Hamilton does a great job just generally with community outreach. We go to a lot of community health fairs, things like that. Giselle actually goes to a lot of community events to talk about the HOPE program and raise HIV awareness. We also have all this information on our website, and we also take out advertisements in local papers to raise awareness around HIV testing, as well as doing community outreach.
Okay. And do you feel that it's doing any good now, or we still need more
I think we're
work?
always going to still need more work. A lot of people kind of feel like HIV won't touch their lives. And even though there are things that put you at risk or higher risk for HIV, absolutely anyone would be at risk. If a person's ever had unprotected sex, they can potentially be at risk for HIV. And people living with HIV are just like your friends, your neighbors. They're just like the people in your life. And a lot of people think that they don't know anyone with HIV or they never would. It's important to raise awareness so everyone realizes that, it's a common thing. It's in our community, and it's important that we have honest conversations about it.
With the HIPAA and the privacy and the confidentiality, do you have anything that once you have a newly diagnosed person with HIV, do you follow up and make sure that they inform their maybe family or loved ones, or how do you go about with?
So, it's of course, it is HIPAA protected information. We do talk to our patients about disclosing to the people in their life that they think it's important that they know, especially sexual partners. A lot of that's actually taken care of through the state of Pennsylvania. They have a program called Partner Services, and they actually have it for certain other SOPs as well, that someone from the health department will come and talk to newly diagnosed patients, talk to them about the importance of letting their partners know, and they'll also offer to anonymously let their partners know that they need to. So that means that the person doesn't actually have to necessarily talk to the partner themselves. They'll a lot of people don't feel comfortable about their diagnosis, especially.
All right. We will get back to you soon. Giselle, can you tell us what you do again and talk about the whole program and what are you doing currently?
Okay. So I've been working with the HOPE program now for a little over a year and a half. So pretty much I do like the social media aspect of it with the HOPE program. I help with their outreach, like Sarah mentioned. I'm kind of getting out there and spreading awareness, going to different local events and sharing information about HIV and the services that we provide here at Hamilton Health Center. I also work with the Opt-in for Life program, which is a health and wellness campaign that is a collaboration between Hamilton Health Center, Alder Health Services, Hershey Medical, and Pinnacle Health. So we kind of collaborate, and we kind of also do a similar thing, kind of getting the word out there about HIV, especially on our Facebook page, our Instagram page, and our Twitter Twitter page. But we also have an app for HIV positive, HIV infected individuals. It kind of helps them to stay in contact with their healthcare providers and kind of gives them medication reminders to remind them to take their medication and things like that. So that's another service that the Opt-in for Life program offers. So that's pretty much what I do here, and just kind of helping to spread awareness, get the word out about HIV and about everything that Sarah did mention. So I've been working with the HOPE program here for about a year and a half, a little over a year now. But kind of to take it back, I was actually born in Liberia, West Africa. And I came to this country. My country had a 15-year civil war. We fled our country 15 years ago. I actually came here over 15 years ago now, but I came here when I was 2 years old. So like most people, honestly, before I started working in this position, I really didn't know too much about HIV. It was something I heard about, and it didn't affect my life in that sense, in that way. So I didn't really know the details about it and really much about it at all until I actually got into this position and really started to learn more and learn how it really does affect everyone in some way or another. Because not only even if you are not infected with it, you could be affected by it, and people around you can as well. So I went back to Liberia, went on vacation. So it actually just started out as curiosity. I wanted to know where Liberia stands in the fight against HIV. And then in doing that, while I was actually there on vacation, I actually was able to get the opportunity to get in contact with and sit down and talk to some healthcare providers back home in Liberia to find out, like example, testing, how they go about it. Are there differences, and how are things there, where are they kind of struggling with, and where do they have to still go, kind of see, compare and contrast kind of thing, like see from what I've learned, see how they're affected by it as well, and how they're growing in that, and how HIV affects, Liberia as well. So that's pretty much what I did. And so now for World AIDS Day on December 1st, I'm putting together a film of my findings, of what I came about finding and what I learned, while I was there. The people that I spoke to, I actually had the opportunity to sit down with a group of men and women who are HIV positive, and give their consent to help spread awareness as well, and be recorded, and for just other people outside of just Liberia to find, to learn more about how they're coping, how they're and how they're growing with HIV and AIDS, and how it's affecting them. So,
Okay.
yeah.
And is this your major, or is just a curiosity? How did it come
curiosity.
about?
It was just
The
a curiosity.
whole-
It was just a curiosity. I'm actually just a vlogger by nature. I
Okay.
love the internet, and I record like pretty much everything. So it's
good.
something. Yeah, it's something that I had recording
Putting
wise,
your
vlogging
talent
wise,
for a good use.
for a good use. Exactly, or another good use. And so with that, I was like, what, this could actually, it's something I want to learn about, and I'm sure there are a lot of people who are also just curious about it as well. See, who knows, where it could go, and how we can all learn how HIV is spread, and how we can all kind of put our talents and our abilities and our gifts together to be able to spread awareness about something that not a lot of people talk about.
Would you like to share some of your findings, or you want to save that for?
I do want to save a lot of that.
Yeah.
I do want to save a lot of that.
You can share whatever you feel like.
Yeah, but I think that one of the most interesting things that I learned. Well, first of all, is that HIV has come such a long way. Like Sarah mentioned, like from where it was to where it is now, it's so much further along, and so many more services and means to help those who are infected with HIV. One of the things that I've just naturally noticed was that the issue of stigma and people not feeling comfortable talking about HIV, just because a lot of times it's because they don't know about it, and because it had such a bad connotation to it for such a long time, that it's something they never talked about, and as long as they didn't talk about it, that's just what it'll go away, and we all know that's not what happens, and a lot of times it just gets worse. So both back in Liberia and here, stigma is still a big issue, and it's still something that's why the importance of spreading awareness is so important, to help to reduce that stigma and get people more comfortable talking about it and things like that. And also just noticed that basic services that are needed here are also needed there, like transportation, medical assistance, medication, reminders, things like that are still also very much needed. There are some similarities. Of course, there are a lot of differences as well. I mean, it's a completely different continent. And when it comes to care, and when it comes to services that they want to provide maybe, but they're not able to, and things like that. So yeah, there are a lot of differences as well, but I was really interested in noticing the similarities and what a lot of the people, what they talked about, like not staying on top of their medication, not consistently taking that. That's an issue everywhere. You know what I mean? It's not just, it doesn't matter where you're from, or it doesn't matter what country you're from. Just people at first accepting that this is something that they have, and then moving forward and taking the necessary steps to be responsible for their health.
You going through the stages
Yep.
Denial, anger,
Yes.
and all that.
Absolutely. Definitely. And then also not even not knowing, maybe not even having people to share that information with, and when people might, and I know at least in Liberia, and I'm sure that's everywhere, some of them shared their stories with me about how they would tell, the people they're closest with around about their diagnosis and or about their HIV status, and a lot of people turn away from them, like they wanted nothing to do with them because they just felt like, honestly, it's just that stigma, having no idea. Like they said that some people really thought that they could get HIV from talking, from shaking hands.
That's why raising awareness is very important.
Absolutely.
Because, like you said, the stigma and education is the big issue.
Absolutely.
So part of it is you talking to people there and here about facts. And would you like to share, or Sarah maybe can share some of the facts about how you can spread HIV? And
Absolutely. Joselle's right. A lot of people still think, even though it's 2017, that you can get HIV from sharing a bathroom with someone or sharing silverware or hugging. But while it's very contagious, it's only contagious under a few circumstances. There's a few body fluids that are able to transmit HIV, so blood, sexual fluids, breast milk, and things like saliva and urine, things like that don't transmit HIV. So there's no way you could get it from someone from casual contact. So if you know someone living with HIV, you can hug them, you can kiss them, you can, live in the same household with them, and it's perfectly safe. The other thing that is important for people to know about HIV is, while it's very serious chronic medical condition, it's 100% preventable. We always teach all of our patients the importance of safer sex, and those are our patients who come in and are HIV positive, and how important it is for them to use protection, both for their own health, to make sure that they stay healthy and don't become infected with another STD, and for their partner's health, to make sure that they don't pass HIV to another person. We also see a lot of people come in for HIV testing that may be at risk for HIV but aren't really practicing the things that they need to do to prevent it. So we try to provide a lot of safer sex education for patients in both of those contexts, just so people understand how to protect themselves and those they love.
a lot of people think that if you are using birth control, that prevents you from having sexual transmitted diseases, which is, of course, not true.
Right.
So what are the things that they can do besides just wearing condom? What else?
So condoms are the biggest thing. I would say definitely use condoms all the time, especially if you don't know your partner's status. For some folks, there's also an option called PrEP, which stands for pre-exposure prophylaxis. And what that is, it's actually taking a dose of HIV medication every day, and it actually prevents people from becoming infected with the virus. So that's usually recommended for folks who have a lot
That's new. I never heard of that.
Yeah, so that's actually new and becoming much more common over the last few years. We do offer it here at Hamilton. So we have patients who may be in a relationship with somebody who's HIV positive, or just have risky behaviors for one reason or another. And if it's a good fit for them, we do recommend that they take PrEP. It really is almost 100% effective at preventing the transmission of HIV.
So for the PrEP, how do people know? Like, how do you know? What is your process to find out if this person
is a good candidate?
Yeah.
So our providers, just as part of routine care, always do a sexual history with patients, especially younger people, to see if they're at risk for STIs, to make sure they're using contraception, if their goal is to not get pregnant. So if it comes up that someone has had, frequent unprotected sexual encounters, or maybe they've been diagnosed with an STD in the past, or they're taking some other kind of risky behavior, like using injection drugs, providers recommend that they may start taking PrEP. It's really easy, 1 pill a day. There is some follow-up that the patient has to do. You need to see them every few months just to continue to do testing to make sure that they haven't become HIV positive, if they haven't been taking their medication. We want to make sure that people are really staying on top of their medicine and taking it every day way to make it work.
Supposed to be.
Exactly. And we all know medication is really hard.
Yeah.
I think a lot of us have trouble remembering to take medication every day. So they need some extra support to make sure that they're doing it. It's covered by most insurance now. And for patients without insurance, there are some pharmaceutical assistance programs that we can help link people to make sure that anybody who needs it can get it.
And that help here at Hamilton Health Center.
Yes.
Do you do how they can get that? Like, how someone without insurance, which we know there is a lot,
Absolutely.
or someone that cannot afford the co-payment,
Sure.
how can they get in touch with whoever will be able to help?
So our patient services department is amazing at Hamilton Health Center, and they or one of our Hope staff members can actually help the patient do an application. Gilead, who's the manufacturer of the PrEP medication,
Okay.
it's called Truvada, has a great patient assistance program. For patients with insurance that have copays, they have like a copay assistance program. For patients who are completely uninsured, they have a program to actually pay for the medication, so patients won't owe anything at all. So we try to link them to that to make sure that they can get the medication, and then they can just go fill it at the pharmacy like any other medication.
Okay, so basically using protected sex, using condom, and if you are somehow linked to someone with HIV or you having a risky behavior, you can take PrEP.
Yes.
And they can ask their provider about that. What else?
So, I mean, we always recommend that you get tested, that you talk to your partners about getting tested. We also recommend people get tested regularly for STDs generally, because if you are positive or you have an STD infection that hasn't been treated, it puts you at greater risk.
Mm-hmm.
Of course, limiting your number of sexual partners helps keep you safer. There's also things doing less risky behaviors, maybe limiting the amount of intercourse you have, things like that. Just sort of any way you can reduce your risk.
And that's when it comes to sexual behavior.
Yeah.
And the other part is drug use.
Sure. So for injection drug use, we always recommend if you can use your own needles, do so. There's also some places we refer to that can do needle exchange. There's a needle exchange program in Paris where I could plug them as well.
We can get the information from you and put it at the end of the video.
Absolutely. If you are using injection drugs and you need clean needles that are safe to use, you can go to them and exchange them for brand new needles that are safe. But mainly we say don't share your needles with anyone ever. If you are going to use injection drugs, if you're not ready to stop, make sure you aren't sharing with anyone, because that's one of the riskiest things you can do, really, is sharing needles with somebody else. Or HIV, hepatitis, really hope our patients are going to do that. Now, if our patients are ready to get in treatment, we of course try to link them up with drug and alcohol treatment, anything that they need. So if they're ready to stop using drugs,
But is it feasible that someone will come to you and say, hey, I'm using street drugs or I'm injecting? I mean, I don't think with the stigma and with legal.
well, there's no, you're sharing it with a healthcare provider, so all of that information stays.
Oh,
with
so
the
you
healthcare
what
provider.
you're trying to say is when you talk to your
It's completely
doctor, just tell them that you are doing drugs, and then the doctor will refer you. But is it safe? Because I'm sure a lot of people are going to be afraid.
Sure.
We are not condoning people using drugs, but if you are doing it, why don't you be safe?
Yes, exactly. I mean, and we always encourage our patients to be open with us. I mean, I think sometimes people are worried that there's a risk, but you can always talk to your healthcare provider about what you're doing. Because of confidentiality, that information is not going to go anywhere. It's just going to help us know how to help you, and we really can't help you with information. So we encourage people to be as open as possible and sort of meet them where they're at. And if they're not ready to change their behavior, we'll try to help them as much as we can where they're at.
To be safe. Okay. And we had a question about, we can go back to sexually transmitted diseases, saliva and sweat and all of that.
So saliva, sweat, urine, none of those can transmit HIV.
Unless you have a cut.
Well, not even if you have a cut. So if you have a cut, so blood, sexual fluids, so either semen or vaginal fluids, and breast milk are really the only four body fluids that can transmit HIV. So if you have a cut, and then someone who has HIV blood gets in your cut, you could be infected that way, though it's really uncommon. But anything like saliva, urine, is all perfect. I mean, you don't want to be exposed.
Yes, exactly. Besides the HIV, there's other issues.
There's other issues, but from an
Health
HIV
and
perspective,
sanitary and
exactly. From an HIV perspective, you don't have to worry about it. I think the other important thing for people to know is if somebody's taking their HIV medication every day, there's a very low risk that they can transmit HIV. So it brings the level of the HIV virus down in the person's body to the point where we can't even find it on a blood test. It's still in there, but we can't see it. And when someone's in that state, it's almost impossible for them to.
Okay. All right. Would like to share some statistics?
Sure. So I think we had talked a little bit before. So there's about 40,000 new HIV infections every year in the United States.
Mm-hmm.
And that number hasn't really gone up a lot or gone down a lot despite our best prevention efforts. Now in Pennsylvania, there's about 33,000 people currently living with HIV, so total people living with the infection. And in our local area, it's about 3,000 people. A lot of people think that probably with HIV is more of an urban thing, about it happening in big cities, but there's definitely a lot of people in central Pennsylvania who are living with HIV.
Mm-hmm. And let's go back to infection.
Sure.
And pregnancy.
Yes,
And babies.
That's a great question. So it's really important to know actually that women living with HIV can have very successful pregnancies and HIV-negative children. It is possible to spread HIV from a mother to her baby. It usually happens during the childbirth process, but with good treatment, the risk can be taken down to almost zero. I think in like the last, I'm not sure how many years, but it's been a really long time in the state of Pennsylvania since a baby has been born HIV positive, which is a huge change from how it used to be. Moms take medication every day, see their doctor like they should, make sure the virus is controlled in their bloodstream. There's no reason it would be passed along to the baby. There's some special care after the baby's born that needs to be taken to prevent HIV. HIV-exposed infants, so those are babies whose moms were HIV positive, do need to take HIV medication for the first 6 weeks of their life, just to help prevent anything if there is some virus in their body, make sure they can fight it off. And also, breastfeeding is definitely out if you're an HIV-positive mom. It can transmit to the baby that way.
Okay. But there is no way of transmitting that while you are carrying the baby.
As long as the mom is on treatment and taking care of herself, it's very unlikely. Even if the mom doesn't know her HIV status when she's pregnant, and sometimes when people don't get prenatal care, they won't find out, though testing is standard for prenatal care. They also test in hospitals when people are giving birth, so if they haven't been tested, mom hasn't been tested, they'll do it right then and there.
And the medications is safe for the baby.
Yes, the medications are very safe for the baby. There are certain medications you can take if you're pregnant and certain ones you can't. But seeing a specialist who really knows what they're talking about with HIV and pregnancy is really important. But you can have a happy, healthy baby and a safe pregnancy.
Okay.
It's definitely possible.
That's good. That's good to know. And then there's another question that when it comes to school and kids and playing sports,
Sure.
How would that affect their sport life?
So, there's no reason someone with HIV can't do anything anyone else can. There's any kind of casual contact, even if you're like playing tackle football and things like that, the sweat and all of that, there's no chance of transmitting HIV. Some people, and there's been, questions about that in the past, especially, are worried about like injuries and bleeding during contact sports. It's a really low probability that HIV can be transmitted that way, especially with treatment, since the treatment really prevents any kind of transmission. Even if you were exposed to someone's blood, as long as they were taking medication, you wouldn't be at risk.
You should be safe. Yeah. Can you talk about the difference between HIV and AIDS?
Sure, absolutely. And they are something that a lot of people think are exactly the same. So HIV stands for Human Immunodeficiency Virus. So HIV is the virus itself that can cause AIDS. So what AIDS is, it stands for Acquired Immunodeficiency Syndrome. Sorry for all the acronyms.
That's okay.
And what that is once someone has been living with HIV for a long time and the virus has started to damage their immune system, we say that they have been diagnosed with AIDS. There's a couple of different ways that diagnosis sort of happens. It has to do with blood levels to see how far their immune system has been damaged, or people start to get sick with other conditions called opportunistic infections. So what that means is when your immune system has been damaged, your body can't fight off infections that a healthy person can. So there's certain bacterias and other viral infections and cancers that somebody who has an immune system that's been really damaged by HIV are susceptible to that most people So that's sort of the difference. So AIDS is a state where HIV has damaged your body and you can't fight infections off the way you used to, and HIV is the virus itself that causes that damage.
Okay. But there is hope even if you are in that state.
Absolutely. So lots of people can come back from being diagnosed with AIDS and being very unhealthy with medication and good treatment and become healthy again. Their immune system can rebuild with the medication. With good treatment, they can be back to living a normal, healthy life and not have those problems anymore.
They will always be on that state, but they will function.
Exactly. So the AIDS diagnosis, once you're diagnosed with AIDS, that diagnosis always stays with you from a medical perspective, but your body can heal itself with medication, really, and you won't be having those issues anymore. Your body will be back in a healthy state, even though you still have the diagnosis. So people come in sometimes very, very sick if they haven't been diagnosed or if they've been out of care for a long time. And with medication and treatment, their body heals itself. And, they go back to having a healthy immune system and feeling good.
Okay. And even with HIV, can they recover, or once you are at that start of that process, you can manage and keep the damage, but you cannot go back to.
There's no cure for HIV yet. There's lots of very smart people working on it, but right now there's no cure. So with treatment, you can prevent the damage to your body. You can keep the virus in check, but it is a chronic disease that you'll always live with.
What do you want to advise or give any last information for the general public?
Sure.
It doesn't matter. You could be talking about the HIV facts and how to prevent that, or about the services again.
My biggest recommendation is if someone has been sexually active at all in their lifetime and they haven't been tested, that they should get an HIV test. They can come see us. They can go see their primary care doctor. To make sure you get tested at least once. I think the other message I have is that it's a serious disease, but it is treatable, and it's not scary. But you don't have to be afraid of people living with HIV. They're just like you. They're just dealing with something else. So I think that's something that I want to let people know. I mean, I've known over the course of my career hundreds of people living with HIV, and they're just like anybody else and have sort of the same needs. They're just dealing with a medical condition. So just addressing that, making sure people know that you don't have to be afraid of those people. You can reach out to them, to your friends.
And is there another centers here in Pennsylvania or in any other state, or this is basically the only place that you guys have?
There's lots of other places people can go to access information about HIV or HIV care. We have other great providers here in Harrisburg as well. Hershey Medical and UPMC Clinical both have great centers that we also work with. So there's a lot of different options to get information. There's also some great websites out there. The CDC's website has really good factual information, as well as if you're living with HIV or you want to know more about what the HIV experience is like, there's also a website called thebody.com, which is designed for people living with HIV, but it has a lot of people's personal stories, things like that. And that's a great resource, too, to learn more about HIV that I recommend to a lot of people, patients or otherwise.
Okay. But for Hamilton Health Center, it's just here?
Yes. Our HIV care is all based here at Hamilton at our main location for now. We do have other sites around the city and some different places. So right here, we're just based.
Okay. And do you do just here, or you have other work that you do outside of Harrisburg or outside of the state?
Well, just here.
Pertaining to the social media and HIV.
No, pertaining to HIV and I work here, and everything I do is based here.
Okay. Any goals on expanding?
I actually this is new for me. I'm learning a lot through the process, so I'm just trying to learn as much as I can and to honestly see where it takes me and how I can use my gifts and my talents to help spread awareness in every way that I can. So I like how social media helps to spread it. It's not just one location. It's whoever hears it, and it gets out to a lot of different people. So I'm looking forward to being able to use use it to be able to just to help spread awareness and get more people unafraid to just ask and know more, and to be able to take help take care of their own health, take responsibility for taking care of their own health as well. So,
Okay.
yeah.
Yeah, that's a really good question. So most people will not actually have symptoms with HIV for a very long time. When a person's first infected with HIV, there's something called an acute HIV infection, so that's right when they become infected. And a lot of times people, they say up to 50% of people feel kind of sick then, but they feel basically like they have the flu. So most people don't really think about that. And that can last for a few days, a few weeks, and then it goes away. The majority of people after that won't have any issues or problems for up to 10 to 15 years if they're not treated. So that's why we really recommend testing, because you can live a really long time with HIV infection without
Knowing.
Yeah, absolutely. And I mean, all the while it's doing damage to your body, it's damaging your immune system, but most people won't know for a really long time unless they're tested. So everybody's disease progression with untreated HIV would be different. I would usually say within around the 10-year mark, people start to potentially have problems. I mean, I think one of the things that can be tricky about HIV, and even for doctors diagnosing it, is the symptoms of HIV aren't very specific. They're kind of the symptoms of other things. So the way HIV works is it weakens someone's immune system. So when that starts to happen, people will get sick with other things. Like you may get sick more often, you could lose weight. They're not necessarily things that are different than other diseases. So the symptoms can be masked by other conditions as well. So really the best thing is just to get tested. Testing. I mean, after 10 or 15 years, people might start to lose weight. They might start to get more frequent infections, like colds and flus and things can start to be much more serious. Sometimes you can have like skin infections, or eczema can get really bad, all sorts of things, digestive problems. They're all like symptoms of other diseases. So it still can be hard for providers to like narrow in and be like, oh, that's what's going on with this person. I mean, I think talking openly with your children and grandchildren and the young people in your life is really important. Just making them aware of it. I don't think, a lot of times STDs, unplanned pregnancy, HIV isn't really on a teenager's radar. They're not really thinking about it. So having those open and honest conversation with kids and being like, this is what's out there, this is why you need to be careful and protect yourself, and helping just talk to kids about how they're going to know when they're ready to have sex, what they're going to do when they feel like they're ready. Things like that. Just having an open dialogue, I think, is the best thing to do. I mean, I am not a parent of a teenager yet, so I don't know. That can be hard, and I totally appreciate that, but I think that's the best thing to do.
The sex education, we don't have, in their curriculums, they only have it as just showing them what to do. There is not, education or discussing this in depth. So it comes down to parents and family members to talk about that.
Yeah, absolutely. And that can be really uncomfortable for people, but it's very important.
And were you covering that on your video, or you just talking about the actual?
I'm not really covering sex education in the video, because there was already so much that they already shared with us just about their experiences with HIV in Liberia. So it's mostly on that, as well as here at the services that we provide here at Hamilton Health Center. For HIV and things like that. So no sex education necessarily, besides prevention, condom usage, things like that. Of course, that's discussed in the video and the importance of it, but in depth, no, not going in depth with that on this film.
And do you have that in Hamilton Health Center? Do you guys have education here? Okay. Any material?
So actually at Hamilton, what we have, and I don't want to speak too much about it because that's not my area of expertise, we have a really great teen program. It's called the Teen Resource Center. And they provide free HIV, STI testing, as well as education, both on site here at Hamilton, and then they also go into Harrisburg public schools. So, and run a health resource center there. So they provide a lot of great education for teens around how to protect themselves and everything like that. We have lots of materials to hand out to patients who come in either for testing or care, or just our general Hamilton patients on how they can protect themselves, which is good information too. But really, prevention with youth and talking to kids is really important, because over half of HIV infections are among younger people. under the age of 35, and I think maybe about 15% are in youth under the age of 24. So it is something that affects young people disproportionately, and and they really do need to keep themselves safe.
Okay. We can go back to sexually transmitted
Sure, yeah.
diseases. Saliva and sweat
Right.
and all of that.
So saliva, sweat, urine, none of those can transmit HIV.
Unless you have a cut.
Well, not even if you have a cut. So if you
Oh,
have a cut,
okay.
so blood, sexual fluids, so either semen or vaginal fluids, and breast milk are really the only four body fluids that can transmit HIV. So if you have a cut, and then someone who has HIV blood gets in your cut, you could be infected that way, though it's really uncommon. But anything like saliva, urine is all perfect. I mean, you don't want to be exposed to
Yes,
someone's
exactly.
body fluid.
Besides the HIV,
Besides
there's other
HIV,
issues.
There's other issues, but from an
Health
HIV
and
perspective,
sanitary and
exactly. From an
Yeah.
HIV perspective, you don't have to worry about it. I think the other important thing for people to know is if somebody's taking their HIV medication every day, there's a very low risk that they can transmit HIV. So it brings the level of the HIV virus down in the person's body to the point where we can't even find it on a blood test. It's still in there, but we can't see it. And when someone's in that state, it's almost impossible for them to reach it.
Okay. So the only problem is when they stop or miss their medication.
Or before they know they're HIV.
Okay. Or before they know. Okay. All right. Would you like to share about the hope, about the program? Where can people get in touch with you, or if someone wanted to have one of you guys come and speak and raise awareness, or just educate?
Well, you can find the Hope program. We also have a Facebook page. Let me not say that. We don't have a Facebook page. We should have one, but we don't. Okay. So, for the Opt-in for Life program, we have our website.
Opt-in?
OPT.
OPT, okay.
And for life, we have our website, optinforlife.org. Let me get the right one.
Okay, we'll have you give us the link, and we will share that at the end.
We also have, we're going to be found on Facebook, Opt-in for Life, OPTINFOR. Same thing on Instagram, it's Opt-in for Life, and same thing on Twitter. Now, for the Hope program, we're here at Hamilton. We can walk right in and ask the front desk. We do have a phone number that we can call, that you can call, or anyone can call if they want to get a hold of someone, if they want to come in for testing. We have information on that too. We're available Monday through Friday, 8 to 8:30 to 4:30. So a lot of people sometimes just walk right in and come to get tested, so we can give you the information for that as well. And you can, should I say me? Yeah, I'll just stick with that. Yeah, I'm gonna have.
Okay, all right.
So if anyone has any questions, or if they want to schedule a time to come in and get an HIV test, or just get more information, or if they are living with HIV and need to get in care, they can definitely give us a call. The number is 717-230-3949. And that's the direct number to the Hope Department. So you'll get someone who is experienced with HIV, works in the Hope Department, and can answer any questions that anyone might have.
Okay, that sounds really good. And before we end this, what do you want to advise or give any last information for the general public?
Sure.
It doesn't matter. You could be talking about the HIV facts and how to prevent that, or about the services again.
My biggest recommendation is if someone has been sexually active at all in their lifetime and they haven't been tested, that they should get an HIV test. They can come see us. They can go see their primary care doctor. So make sure you get tested at least once. I think the other message I have is that it's a serious disease, but it is treatable, and it's not scary. And but you don't have to be afraid of people living with HIV. You know, they're just like you. They're just dealing with something else. So I think that's something that I want to let people know. I mean, I've known over the course of my career hundreds of people living with HIV, and they're just like anybody else and have sort of the same needs. They're just dealing with a medical condition. So, just addressing that, making sure people know that don't have to be afraid of those people. You can reach out to them, to your friend.
And is there another centers here in Pennsylvania or in any other state, or this is basically the only place that you guys have?
There's lots of other places people can go to access information about HIV or HIV care. We have other great providers here in Harrisburg as well. Hershey Medical and UPMC Clinical both have great centers that we also work with. So there's a lot of different options to get information. There's also some great websites out there. The CDC's website has really good factual information, as well as if you're living with HIV or you want to know more about what the HIV experience is like, there's also a website called thebody.com, which is designed for people living with HIV, but it has a lot of people's personal stories, things like that. And that's a great resource, too, to learn more about HIV that I recommend to a lot of people, patients or otherwise.
Okay. But for Hamilton Health Center, it's just here?
Yes. Our HIV care is all based here at Hamilton at our main location for now. We do have other sites around the city and some different places so may. Right here, we're just
Okay. And do you do just here, or you have other work that you do outside of Harrisburg or outside of the state?
Okay. Well, no, yeah, pertaining to HIV and I work here and everything I do is based here.
Okay. Any goals on expanding?
Yeah, I actually this is new for me. I'm learning a lot through the process, so I'm just trying to learn as much as I can and to honestly see where it takes me and how I can use my gifts and my talents to help spread awareness in every way that I can. So I like how social media helps to spread it. It's not just one location. It's whoever hears it, and it gets out to a lot of different people. So yeah, I'm looking forward to being able to use it to be able to just to help spread awareness and get more people unafraid to just ask and know more, and to be able to help take care of their own health, take responsibility for taking care of their own health as well. So yeah.
So here you have it. We cannot give you everything out there, but we can open your eyes, and it's up to you to research and to find out what can you do to protect yourself or help others protect themselves. And even if you have a family member or a friend or someone in the community who's living with HIV or AIDS, they're not contagious per se. You can hug them, like Sarah said. Just learn how to protect yourself. You can go back and read about everything that we just talked about. We will put down the link at the end. And please be safe, practice safe sex, and don't do drugs. But if you are doing drugs, please be safe. There is options, there is ways, and there is hope. Have a good day.